Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about ICD-10 CM PCS updates 2023 4th quarter part 3. In this video, we're going to cover new coding clinic updates on Shwachman-Diamond syndrome, immunoglobulin G4 related disease, autosomal dominant hypocalcemia and hypoparathyroidism, lysosome associated membrane protein 2 deficiency, and leukodystrophies. So let's get started with the first one. Shwachman-Diamond syndrome. And the update here is a new code was created to identify Shwachman-Diamond syndrome, and the code is D61.02. Next coding clinic update is immunoglobulin G4 related disease, and the update is a new code was created to identify immunoglobulin G4 related disease, and the code is D89.84. Next update is autosomal dominant hypocalcemia and hypoparathyroidism. Code E20.8 has been expanded by the creation of a new subcategory E20.81, that is hypoparathyroidism due to impaired parathyroid hormone secretion, with specific codes to identify autosomal dominant hypocalcemia and various types of hypoparathyroidism as follows. So the code E20.81 has been further expanded as E20.810 autosomal dominant hypocalcemia, E20.811 secondary hypoparathyroidism in diseases classified elsewhere, E20.812 autoimmune hypoparathyroidism, E20.818 other specified hypoparathyroidism due to impaired parathyroid hormone secretion, E20.819 hypoparathyroidism due to impaired parathyroid hormone secretion unspecified, and E20.89 other specified hypoparathyroidism. And the question here is, a patient with muscle spasms and cramping in the hands and feet was diagnosed with autosomal dominant hypocalcemia. How is this diagnosis coded? And the answer is, we have to assign code E20.810 for autosomal dominant hypocalcemia. Next update is on lysosome associated membrane protein 2 deficiency. Subcategory E74.0 glycogen storage disease has been expanded with the creation of code E74.05, and that is lysosome associated membrane protein 2 deficiency. Next coding clinic update is leukodystrophies. New codes have been created to identify 15 types of leukodystrophies. These codes have been placed into 8 different categories or subtypes based on the cause to represent these complex disorders, and they are E75.27 Pelizaeus-Merzbacher disease, E75.28 Canavan disease, E79.81 Aicardi-Goutieres syndrome, E79.82 hereditary xanthinuria, E79.89 other specified disorders of purine and pyrimidine metabolism, E88.43 disorders of mitochondrial tRNA synthetases, G11.5 hypomyelination, hypogonadotropic hypogonadism, hypodontia, G11.6 leukodystrophy with vanishing white matter disease, G23.3 hypomyelination with atrophy of the basal ganglia and cerebellum, G31.80 leukodystrophy unspecified, G31.86 Alexander disease, G90.b LMN-B1 related autosomal dominant leukodystrophy, G93.42 megaloencephalic leukoencephalopathy with subcortical cyst, G93.43 leukoencephalopathy with calcifications and cyst, G93.44 adult onset leukodystrophy with anoxal spheroids.
Please like, share and subscribe to Expert Medical Coding. Thanks for watching.